so we're almost up to 60 here, and it is 4:01. So I think we should get going. And so thank you all for coming to the first online town hall that LD9 has attempted to do, and we're online, so I'm glad for that. It was the first time I've ever tried to do one of these with more than my grandchildren or my seatmates. So I am Representative Pam Powers Hannley. On the phone are also Dr. Randy Friese and Senator Victoria Steele, and we're going to talk about COVID-19 today and answer some of your questions. People are still joining the chat room here, even though I said admit all. And so I'm going to start out a little bit. You might have seen that Doug Ducey had a big press conference yesterday, and he talked about his testing blitz that he's going to have. And he also addressed the issue of whether or not he was going to open the state on May 1st, tomorrow, like some of the other red states are. And so we were glad to hear that he's not going to open it wide up on May 1st. And you might have heard that the legislature is also not going to be there tomorrow on May 1st, so that's good. And people are still joining. And so I thought it was really good, some of the things he said. I actually wrote some notes here. And there are going to be some loosening of restrictions between now and the 15th of May, but he has said he would have an eye on the data. So I think that's good. I think he heard all the people who were saying on Facebook and Twitter that, you know, it was maybe too soon to do this and we don't want to lose the gains we've made. And he mentioned that several times. He says, we don't want to lose the gains we've made by the social distancing and the wearing masks in public and things like that. So that's good. And I'm not going to go into any more detail really about what he said. I thought I would read you the statistics from the Health Department website for today. So for April 30th, it says we have 7,648 total cases, 320 deaths, and 71,786 tests. So in the next 3 weeks, Governor Ducey wants to do 30,000 to 60,000 more tests. So this is our baseline. With today, before the blitz, there's around 70,000 tests. And as you may know, that we have been number 49 out of 50 for testing. So we have been really, really low on testing. And we're lucky that we are in as good a place as we are on COVID-19. And I think it's because of all of us staying home and doing what we were told, right? And so we don't want to blow it now. So in Pima County, so for the whole state for new cases today, we had 446 new cases, 16 new deaths, which is sad, but you know, still kind of small. So that's good. We're not New York City, right? And we had 2,973 new tests reported today. So that's good too. In Pima County, we had 1,241 total cases as of today, 80 deaths. Pima County, 8,758 tests. New cases today, 26, also pretty low. New deaths today in Pima County, 0, so that's good. And the number of new cases, new tests reported today was 302, so that's good. So that shows us where we are when we're number 49. And the testing, as you probably all realize, is really important because there are people walking around amongst us who are positive for COVID-19, but they may not know it because they're asymptomatic. And so we need to know who these people are. We need to contact people who are positive and find out who they've been in contact with. You probably heard about the contact tracing. We really need to have a lot of phone calls being done around the state with saying, okay, you're positive. Who did you see last? Who have you been near? You know, and so they can start building this branch of where the infection has been, so we can stop the people who are positive for COVID-19 from infecting people unknowingly. And so one of the things that I kind of looked up more about the testing blitz, and so it's going to be May 2nd. That's this Saturday, so it's May 2nd, May 9, and May 16. And so again, he wants to do 30,000 to 60,000 new tests over those 3 Saturdays. And so there's a huge list on the Arizona Department of Health Services website. So Up until now, you had to have some kind of really strict symptoms in order to get a test. But with the testing blitz, you have to have some sort of idea that you've been infected somehow. Like, so maybe you have a family member, or you know somebody, or went to a big event, or, you know, whatever. If you think you have been exposed, you can get a test, is what they're saying. And there is quite a long list. When I looked there earlier this morning on the health department website, there was only a couple in Pima County. There is now a significant list of places that you can go to get tested in Pima County. They're primarily at Banner Health locations, Walgreens locations, and El Rio locations. And they're scattered around the county. And so you do have to register and get an appointment. I did read that they're actually allowing people to get appointments before Saturday because they have some, particularly at Banner, so that's good. So the website is azhealth.gov/testingblitz. And I have that link to my website, also powersforthepeople.net, and I put it on Facebook, and they have graphics for social media, so you're going to be seeing that, and it's pretty easy to navigate. It's also a different tab on the same website that gives you all the data about what's going on. So one thing about the test that they're giving, it is the diagnostic test. It's not the antibody test. It has been kind of controversial as to whether or not it's working. It is a diagnostic test, so you have to be willing to self-quarantine for several days afterwards until you get your results, right? And so you are going to have to stay at home. This is not going to not a test that you're going to know immediately whether or not you're positive or whether or not you've been exposed. And so I think it's a really good thing. I don't think there's much testing in rural Arizona, unfortunately, but there is quite a bit in Tucson and Maricopa, and there are sites in Navajo, which is a real hot spot. Lastly, I'd want to make a pitch for the prisons and the long-term care centers. Those could be, you know, really seriously infected areas. We've seen this in other states, and the testing blitz is not going into those areas. And so many people in the Democratic caucus are saying we need testing blitzes in the prisons and the long-term care centers because we need to keep the patients and the prisoners and the workers in those facilities safe. And so that's all I have to say about testing. So that's the end of my portion of the show. And I thought each of us would do our little portion, and then we'd open up to questions. And Jim has actually just been sitting here looking at your pictures and not looking at whatever comments you made. Okay, all right. So James Barris says something about the turnaround for testing. I think it's going to be in the neighborhood of 7 days. It's not going to be 20 minutes or 24 hours from what I hear. I met with Maricopa County, Marana Health Center before this call, and they were saying 7 days.
Pam, can you hear me?
Yeah.
All right. First of all, apparently people are texting us saying that they can't get in. They're trying to get in. So if you could have Jim check that, or you could check that, that would be great. And somebody else said, are you implying that you can, who was that said? Marie Hidalgo.
Okay, I just let a whole bunch of people in. While I was talking, they were stuck in the waiting room. I'm so sorry, people.
No problem. Maria Hidalgo wants to know, Pam, are you implying that anyone can get a test regardless if they feel ill? If they don't feel sick, can they still get it if they think they've been infected?
Exactly. So if you think you've been infected, you can get a test. So they have changed the rules, because that's why we were number 49 out of 50 in the state of testing, because it was so strict on who could get a test. You had to almost be to the point of being admitted to the hospital to get a test before. Now it's if you think you have been infected. And again, that website on Arizona Department of Health Services testing blitz, you can just Google that, Arizona testing blitz, and it comes right up. And you call ahead and make an appointment.
And I do want people to know that we will probably see a real spike in the number of confirmed cases right after these get through and get processed. Don't be surprised. And then we should start looking for that 14-day decline in number of confirmed cases before we can move into phase one of the reopening.